Good evening, everybody. I'm Dr. Munish Arora. I'll be discussing about some common dermatological conditions in childhood age. This first class will deal with some of the common conditions, and in the next class, the remaining conditions and further conditions will be discussed. So, first of all, I'll discuss about atopic dermatitis. Atopic dermatitis affects 10 to 30% of children, and there is a phenomena called as atopic march. That is, atopic children or children who are having atopic dermatitis are more prone to food allergy. Then they develop allergic rhinitis, and in adulthood or adolescent age, they are more prone to developing asthma. So this is a form of atopic march. Food allergy comes, then allergic rhinitis, and then asthma. So etiology and pathogenesis, the main etiology of atopic dermatitis is related to the skin barrier. There is a role of defective skin barrier. The children have reduced skin innate immune response, and type 2 adaptive immune response is more in these children. So by understanding this photograph, we can understand the etiopathogenesis of atopic dermatitis. In these children who are more prone to develop atopic dermatitis, the skin barrier or epidermis is disrupted. So the allergens pass on through this disrupted barrier, and they enter the Langerhans cells, and from that they enter dendritic cells. Dendritic cells, when they contain the antigen or allergens, they stimulate the T helper cells to T helper type 2 cells. These Th2 types of cells are secreting interleukins 4 and IL-13, which are more in children with atopic diseases, IL-4 and IL-13. These IL-4 and IL-13.
Skin problems are one of the most common reasons patients visit OPD. But are we identifying them correctly? From acne and pigmentation to chronic inflammatory skin disorders, doctors frequently encounter eczema, dermatitis, and fungal infections in daily practice. Early recognition of psoriasis and autoimmune skin conditions can significantly improve patient outcomes. Clinical dermatology training helps doctors improve diagnostic accuracy and treatment planning.
Then comes the role of topical corticosteroids. They are used in acute exacerbations of eczema. Ointments are better than creams because ointment occlude the skin, resulting in better systemic absorption. So if the same drug is available in ointment form and cream form, we should always use the drug in ointment forms. These corticosteroids are grouped into different classifications. The potency of the topical steroids decreases from group 1 to group 7. So we should use the steroids falling in group 6 and group 7. If hydrocortisone ointment is available, it should be the drug of choice. Otherwise, desonide ointment, 0.5%. This should be the creams or ointment should be the topical corticosteroids of choice in atopic dermatitis patients. Topical calcineurin inhibitors or topical tacrolimus ointment, 0.1%, comes next after topical steroids. They are used in moderate to severe atopic dermatitis. For children and adolescent seborrheic dermatitis, it doesn't resolve by its own. It is a chronic relapsing disease. So first line of management is antifungal shampoo containing selenium sulfide, ketoconazole, or coal tar. Low potency topical steroids can be applied once daily for 2 to 4 weeks. And in non-scalp areas, topical steroid cream and topical antifungal cream have to be applied. Is the first line of management for dandruff. Dandruff, what we call, is also a form of seborrheic dermatitis in medical terms. Layman's term is dandruff, medical personal term is seborrheic dermatitis. So management is antifungal shampoo or ketoconazole shampoo. Second line therapies are topical tacrolimus and other keratolytic agents. Oral antifungal agents are to be used in resistant cases, and prevention of seborrheic dermatitis is usage of antifungal shampoo containing ketoconazole twice weekly. So coming on to some important bacterial infections of skin.
Dermatological conditions in children and adolescents are becoming more common every day. Teenagers frequently experience acne, oily skin, and recurrent breakouts. In children, eczema, itching, and allergic skin rashes are commonly seen. Fungal infections, scalp disorders, and skin allergies are also rapidly increasing. Early diagnosis and proper dermatological care can prevent long-term complications. Enhance your dermatology expertise to confidently manage pediatric and adolescent skin conditions.